and Interim Director of Commissioning Partner at CCG, and it's lovely to see so many people at the event. It's great. It's lovely to have such a wide range of people who are participating. What I wanted to run through was the work that's been done so far within the CCG on looking at vision and looking at the priorities that we've already got listed and identified. And that's part of the conversation that we want you to have at the table this afternoon, which is around looking at the what else and what do we need to reprioritise, what do we need to look at, what have we missed out from priorities, and we'll get those questions back out to you again. So if we move on to the next slide. What we've identified so far, and there are a couple of things that we will look at picking up in the presentations, is a number of CCG priorities. So urgent care, mental health, stopping smoking, stroke, cardiology, end-of-life cancer services, long-term conditions, care homes, maternity. I think it's just that letting people know this is not the programmes on everything that we commission, because actually what we commission services for probably every one of those yellow stickies that is around the room, but it's about the prioritisation and the focus for the CCG and how you are helping us to shape and influence and relook at our priorities and how we feed that into the development of our strategy for next year and for the next 5 years, which is what we're talking through. We talked before, and I've talked at this session, and you may have heard in the press around commissioning for outcomes. And I think I find that sometimes a difficult concept to understand, and just in terms of explaining what that means in quite simple language, the NHS, or the Department of Health, has just published the NHS mandate, and it talks about outcomes framework, and we use the outcomes framework for looking at our priorities and understanding how we map that. But then effectively map back to the mandate that we now all have as delivering services within the NHS. And that's around providing safe care, helping people live longer, helping people manage their ongoing physical and mental health conditions, helping people recover from episodes of ill health or injury, and making sure people experience care better. And I think it's those sorts of principles that we have to work within, and that actually mean that we start to think about how we're commissioning our services in a different way for our population, and using your input to, I suppose, ensure that we're delivering, holding us to account on delivery of all of those aspects of care, so that services we commission actually meet those needs, so meet the needs of our patients with long-term conditions, actually manage them effectively, and actually support recovery and support delivery of services safely across our whole community. We've talked about our priorities, and we've talked about how our priorities have been informed by the health and wellbeing strategy, and we just wanted really just to sort of putting that back up on the board again to say actually that was one of the documents, that was one of the drivers that we have looked at. So what are the priorities for our local area, and how do we ensure that the priorities that we have as a CCG sort of fully reflect and we fully adopt and work with and have programmes of work that allow us to make changes to services that will deliver those outcomes. So ensuring that we have patients, fulfilling lives, people with learning disabilities. Looking at the reducing smoking, some of these are public health targets, but we also deliver them in the CCG and the health sector. So it's the sort of the common and shared targets across health and social care. The financial plan, and I couldn't leave the financial plan slide out of mine just because Nicholas had it in his, because it is one of our biggest challenges. And the challenge is around that we will have a very limited, or we're expecting a limited resource uplift. We are expecting that the quick challenge next year, the challenge that we need to look for in terms of service delivery, is going to be of the order of 20 million. And is what does that mean in services for our local population? How can we make very large-scale changes in the way we deliver services in order to get very good care delivered for our population without seeing a loss as a result of implementing a change? And there's certainly, you mentioned King's Fund, but there is one of the areas that we were talking about this morning was the shift to community. So the reduction in reliance on acute care, which is an expensive way of delivering some of our services, and looking at what can be done to ensure that we are building community-based services, and sort of mobilising and working with the wider health system and with our patients and with our population to ensure that we can deliver major change in how healthcare services are delivered going forward. We've mentioned the quick challenge in terms of the CCG, and we are looking at the work and how we organise our work, and that's one of the conversations that you would be able to help us with in terms of priorities. So we've identified priorities of work. How do we actually pull together programmes? Who is it that would wish to work with us in developing programmes of work that will address and meet the needs in terms of each of those priorities that we can actually then mobilise within the local area, that we actually implement, that would bring about change in the local area. The 5 areas that we've got, we have got an awful lot of work underway in each of them. So unplanned care programmes, we've implemented one recently. So I think it's not that we're starting from a position where there is nothing happening in terms of change of services within the CCG localities, but it's around what could be done in terms of greater ambition to be able to implement change and to be able to get us to a very clear strategic direction that will give us a 5-year plan that does say actually what is the size and scale of movement that we want around the different services, what is it that we need to target within different locality areas, and what sorts of services will help us to make the sorts of changes that will do the resource release that we can reinvest in the best effect for our local population. In terms of approach, we as the CCG are doing the contracting process, the commissioning process for the £652 million worth of spend. And there's something about actually being accountable to you around how that is managed, how that is delivered, what it is that we do in setting contracts. I mean, we've actually got lots of people in from voluntary organisations as well as our main NHS providers and social care, and that was something that had been fed back from some of our locality conversations, was really about how do we start to engage differently with providers across the whole sector that might allow us to make changes in the way services are delivered within the CCG area. So looking at the contracting standards, looking at how we ensure safe care is delivered, so the slide that Nicholas had focused on in terms of patient safety, to make sure that whatever we are commissioning on behalf of the population and hearts families is safe and effective in what is being delivered. At the heart on that, we've talked about having patient engagement, and I'd say Heather is tweeting the event today. We've had Age Week back in around actually how we're doing this and how is there going to be opportunity to involve young people in some of the agenda. And that's certainly absolutely, we want to make sure we're establishing links now to help us work effectively and do the sort of the planning process. Because one thing that this is not, in terms of this event, it's not a sort of a one-off event. It is a part of a process that will take us through to be able to produce our integrated plan and our strategy. We need to be able to articulate that, we need to be able to write that down. But it is about a process of engagement with you from whatever organisations or whichever practice or whichever locality is there to actually engage with the CCG. And I say on the urgent care, we have had a lot of children and young people involved very recently in the work on redesigning the urgent care pathway from the, I think it's whole pathway journey, so it's not only the hospital end but through from community, and the schools are involved in that and a very wide range of input. So it's very definitely that there will be a number of opportunities going forward, and that's what we want to try and ensure that we secure today, the links and the opportunity to work with and the opportunity to make sure you understand that there is an opportunity to shape and help our planning process and then actually be operational and mobilising, putting our plans into practice around that. Okay. So in terms of approach to commissioning, we have talked already around the commitment to safety and quality. We've talked a lot around the clinical leadership, and I know we've talked about the number of GPs in the room, but what we're also seeking to build on is the broader clinical leadership. We've recently appointed our secondary care doctor to the board, we've appointed a nurses executive to the board, but we're also engaging in partnership groups with secondary care consultants. We're engaging on a much broader basis. We're looking at our urgent care and trying to ensure that we have clinical engagement, not only from primary care but for secondary care on a regular basis, so that you are planning services that are clinically driven for delivery across Hearts Valleys. Focused on outcomes, it's going back to what is our mandate and what we're trying to achieve, and also linking back to Louise's presentation in terms of there are significant differences in outcomes across Hearts Valleys CCG, and it's understanding the reasons for that and what's the opportunity that we have and what opportunity can you help us with to actually change some of those differences in outcomes over time and get that right in our planning processes. Need and equity, that was part of the whole reason of bringing this meeting together, to try and present and to explain and to say actually we are looking at this. Before this session with the wider audiences, we've also had discussions within each of the locality groups across the CCG, so we've had 4 sets of conversations, principally with GPs within the areas who are the clinical commissioners, and that is to promote the conversation about what are the commissioning ambitions, what are the opportunities and what are the challenges at a locality level. And it's that information which is feeding into some discussions that you'll have on your tables later on, and will continue to feed into the strategy and the planning processes going forward. In terms of the decision-making processes, that's something that we are at the moment working within prioritisation frameworks that we've had historically. And what Nicholas has said is actually we've adopted a number of I suppose policies and procedures. That's one which we are developing as a CCG, and that will be published. It will be, again, conversations within the next few weeks, and we'll get that publicly available so that people can see and understand what is the decision-making and the prioritisation process that the CCG is working within, and try and make sure that that's very accessible. So partners, I was just mentioning the who else and the how we link across. We don't do commissioning in isolation. We work with public health needs who are now sitting alongside health, the local authorities in terms of health and wellbeing boards. We also have HICS, and we've got some of our HICS staff today, and that's Hertfordshire Integrated Commissioning Services. They provide us with a huge amount of resource and information about exactly, so where do our patients go? Where do our patients access services? How do we understand what they're doing? And to some extent, what choices patients are making about how they're using services at the moment. So we have all that information, and they do our core contracting work for us. And so we have an ongoing relationship with them. And then we've got the wider partnership agenda. So joint commissioning, health and wellbeing boards, and very active involvement with neighbouring clinical commissioning groups as well. So we want to make sure that if there is something that makes sense to be done on a pan-Hertfordshire basis, then we'll work across pan-Hertfordshire and make sure that that happens. If there's something where it's working in with the London commissioners, so a lot of our work goes into Barnet and Chase Farm Hospital, there are pathways and work that we would want to do collaboratively with some of those commissioners in those areas. So understanding how our patients use services and really how we can make most effect and get best effect out of the use of resources around it. So this is just summarising, and to some extent this is where this event stemmed from when we were talking about it a good couple of months ago. It is the what do we need to do in order to develop our strategy, and it is the bringing together, and I suppose we're at the top section of that at the moment. At the moment we are facilitating a lot of conversations around what are our priorities right, how can we revise, reflect, update and take on views around that. And we will then do the work that actually builds that into a plan which is owned by Hearts Valleys CCG. It will be a public document. We will share that with Health and Wellbeing Board. So we will share that broadly. It will be published on our website to make sure that you understand what it is that we're taking away from this sort of event and building into our plans. We will be looking at developing integrated plans, but then looking at underneath that is looking at actually, it's not just about talking, it's actually about doing something differently. So having some real detailed working arrangements, so operational groups are actually looking at, we make changes, we decide priorities, and we then put in place working groups that will help us implement that change. And that's one of the other question that we got for the afternoon. How do you help us to translate all the conversations that you're about to have at the tables into real opportunities for change within the local area in terms of services that are provided? Now, I think I'm just about to time. We've got the only thing I was going to bring back up, we've got the two questions that you're now going to be asked to the next. So in terms of priorities, there are questions about, do our priorities feel right? Are there things that we have missed off completely? Are there challenges that you would give back to us in terms of what those priorities should reflect? And really, what are your top 3 priorities? That was the other question in terms of discussions at the table. And that's something where we will feedback, and we're going to try and capture that at the end of the afternoon and just put that back up to you in terms of the presentation. But we want that to be done first, and we'll pick up on it, and then we'll move into the how do we look to achieve those aims. I think we're going to do half an hour for the 2 sessions. That's about it.